Randomized trial of erytropoietin for neuroprotection is preterm infants. Definition: recombinant human erytropoietin is a promised pharmacological agent for neuroprotection in neonates.
Class of 2015, we're here to present our review paper on antenatal exposure to magnesium sulfate and neuroprotection in preterm infants, written by Constantine and Drever, published in the Obstetric and Gynecology Clinic of North America in 2011. In this article, neuroprotection of magnesium sulfate is studied using cerebral palsy as the neurological disease model. The disease of the article, hence also our discussion today, has the following objective. First of all, let's just recap what is cerebral palsy. It is the most common cause of motor disabilities in childhood. It is a heterogeneous group of non-progressive clinical syndromes characterized by motor and postural dysfunction. This picture nicely shows the different subtypes of cerebral palsy: spastic, dyskinetic, and ataxic, as well as respective subtypes. As you can also see from the brain illustration on top, involvement of different areas of the brain will have different manifestations, just like stroke. But unlike stroke, these are permanent, and therefore it is a devastating condition for the children to have. The current
Application is NERS. Prophylactic administration of in very preterm infants improves neurodevelopmental outcomes.
Have been so far, and this is what to expect over the next few days. Now, in neonatology, when you have a sentence, when you have newborn or neonate and cool, you cannot but really think of one particular person who has done a lot of work on neonatal encephalopathy. So it is our next presenters. I'm very pleased to be inviting Professor Dennis Anupadi to come and talk to us. Now, Professor Asopadi is a professor of neonatal medicine at the Imperial College London and a consultant neonatologist in both Queen Charlotte and Chelsea Hospital. He has been the leading UK researcher into whole body cooling to decrease the sequelae of neonatal encephalopathy in the term and near term infants, part of the TOBI trial, and he is very keenly interested into neuroprotection strategies, including body cooling. So it's my pleasure inviting Professor Azopadi to talk to us about neuroprotection strategies.
Good morning, and thank you very much for the very kind words and for the honor for inviting me to this fantastic meeting. It's a real privilege actually to be here and to learn from some of the giants of neonatology that were mentioned this morning. I should see them speak, and I've probably learned more than I'm going to teach this morning. I'm not actually going to talk about cooling. There was a workshop yesterday about cooling. We spent a lot of time discussing cooling yesterday, and I'm sure you've read lots and lots about hypothermia. It is a major advance in the care for babies with asphyxial encephalopathy, but it is not by any means a silver bullet. It is not by any means a treatment that we would call sufficiently effective. We need to remember that the chances of death or severe disability in survivors in babies who meet the protocol criteria for treatment with cooling is still over 40%. So there is an urgent need for additional therapies or attempts to try and improve the outcome for these babies. And what I've been asked to do today in a very brief period of time is to think about what are our strategies for improving the outcome for these babies. And clearly, the most
Pros and cons. High-dose erythropoietin has been shown to have a neuroprotective effect in preclinical model of neonatal brain injury.
about EPO neuroprotection as a therapy for newborn infants that are either term with hypoxia-ischemia or preterm infants who are at risk for long-term neurodevelopmental problems. In the talk I gave today, I gave the background data for why it might be therapeutic, and also covered some of the retrospective studies that have been done, and then was talking about planned or ongoing trials. In specific, we have a planned trial that I was talking about that would involve extremely low birth weight infants that are at risk for neurodevelopmental impairment. So the goal is to see whether high-dose EPO would improve neurologic outcome for these babies. So absolutely, that's what we're trying to show.
Use oblique to Ecuador. In one trial, dog living his 2 erytropoietin was performed. We assigned babies browns with their gestation to receive erytropoietin or placebo within hours after birth. Erytropoietin is administered intravenous at a dose of body between every hours for a total of 6 doses. After a maintenance dose per week by subcutaneous injection for postmenstrual age.
Amy was in her mother's womb for only 28 weeks, too short a time to be properly ready to live. Her lungs were not working properly yet. She found it hard to absorb vital oxygen. In Amy's body, a substance was missing. The doctors call it surfactant. Normally, the substance lines the alveoli. These are tiny cavities through which oxygen from the lungs passes directly into the blood. Surfactant makes the alveoli elastic and stable at the same time, important for being able to breathe in and out. If the surfactant is missing, the alveoli collapse. Normal breathing no longer functions. The body gets less and less oxygen. Asphyxiation threatens. Until the 1960s, as a result of the so-called respiratory distress syndrome, 90% of all premature babies died. It is only from the 35th week of gestation that surfactant is produced in sufficient quantities, and medication did not exist. But then, a Swedish physician began developing exactly that. Tora Kurstedt has dedicated his entire research life to the substance surfactant, and it's been worth it. We've saved the lives of at least 500,000 children. This happiness is hard to describe. Surfactant was known to act on the membranes of lung alveoli. Like a kind of lubricant, the substance makes breathing possible in the first place. Responsible for this effect are certain molecules, phospholipids.
Conclusion. Prophylactically improvised cognitive development in preterm infants at outset by 10 MDA at a correct age of 18 and 24 months, with no other neurodevelopmental outcome.
Sandra Jewell, and I'll be talking today about erythropoietin as a neuroprotective agent. A little bit different than the way that we normally use EPO. I have no financial disclosures to make, but I do have to tell you that the use of EPO for neuroprotection is an off-label use. So the objectives for this particular talk are to talk a little bit about brain injury in context of neurodevelopment and the situation that the baby is born in. We'll also talk about some different promising neuroprotective agents, what's in, what's not. And then I will spend the rest of the time talking about EPO. Okay. Thank you for letting me know. Is the microphone working?